whether you have COVID-19 or not. Two new tests endorsed by the Department of Health promise to give results in 90 minutes. This one has been trialled in hospitals. And there's another that will be very important in winter months, which can tell the difference between flu and COVID. That's for care homes and lab settings from next week.
Which just tickles the surface of
Professor Chris Tumazu came up with the design for the tests that have been used in hospitals.
The difference will be huge because just the transport time in taking a saliva swab to a lab and doing all that manual pipetting and extraction, that adds hours to the time of the test. Here you're actually bringing the test to spoke areas of hospitals. We've completely decentralized pathology labs.
Say if there are issues with schools in the future, and especially with them looking to open up in September, could these tests be used by laypersons in other settings?
So it was already developed for the consumer world. So then bringing it into a care home or school environment is actually so straightforward.
At the moment, a third of all tests take longer than 24 hours to process. This is one of the 8 hospitals where the new tests have been used, including here in the A&E department, but also in maternity wards, where getting a fast test is really important. Now, this has been seen as a significant development, but for some in the care sector, they're a little bit sceptical.
It sounds like the answer to all our prayers, and I really hope that it is what it promises to be, because it's a long time coming for us. But more importantly, what it needs to be is available. It needs to be available to the sector on a regular basis, on a daily basis, so that we can mitigate this enormous risk of this virus in our services.
Here in Manchester, they've seen a rise in cases. Today, the UK has posted the highest number of positive tests for around a month, over 900. Authorities in Greater Manchester declaring a major incident, but adding that people shouldn't be alarmed as it was standard practice. In Leicester, there's relief for many as some lockdown restrictions were eased, but there are still rules around visiting your friends and families in their gardens. While 90-minute tests are being seen by some as the glimmer of hope we need to cope with COVID, the World Health Organization this afternoon warned that testing alone isn't enough.
There is no silver bullet at the moment, and there might never be. For now, stopping outbreaks comes down to the basics of public health and disease control: testing, isolating and treating patients, and tracing and quarantining their contacts.
Back in the UK, leading scientists Sir Paul Nurse is calling for clearer messaging from the government. How important is it for the public to have buy-in to this?
Having the public buy into a situation like this, a pandemic, is absolutely crucial. The public have to have trust in the government. They have to have trust in what they're being told. They have to have trust that the best decisions are being made for them. And if they don't, then they won't respond properly. They will get confused. They will get stressed. So trust in the whole process is critical for success.
So today there's optimism from the government on these new tests, but a more pessimistic outlook from World Health authorities, who want countries to know this is far from over.
Well, we're joined now by Professor Sir John Bell from the University of Oxford, who's been advising the government on tests. Good to have you back on the programme, Sir John Bell. It almost sounds too good to be true, this test. Is it reliable? Is it as good as it sounds?
Yeah, so I think this is a pretty important step forward, because it will allow for a much more distributed system of testing to occur. The test is really a combination of 2 different tests. A test called the LAMP test, which is a form of amplification at the front end, and then a sequencing test at the back end. And you can stick them together in a 90-minute test, and it gives you very, very sensitive results, equivalent really to the other PCR tests, which are the way for detecting virus at the moment. So it's that sensitive and at least as specific, because you end up with sequence at the end, so you can be sure you're dealing with the virus when you get a readout. So it is a very interesting new step forward.
Now, in Aisha's report, we had this image of teachers perhaps administering the test in schools. Is that actually realistic? I mean, could it be done? Is it simple enough to do? And also, you're going to need millions of test kits, aren't you?
So, like all testing, the biggest challenges are the front end and the back end. And by the front end, I mean, how do you get the samples to the machine? And how do you get them in the machine? And this machine for the Lampore test, which I'm talking about, really does require some kind of a technician. Doesn't need to be a doctor, doesn't probably even need to be a nurse, but somebody who can handle the samples, some of which, to be clear, will be infected. So you have to be cautious about that. And they need to go into the machine in an orderly way. And that's one thing if you want to do 10 tests at a time. If you want to do 50 tests at a time, that gets much more complicated. If you want to do 1,000 tests at a time, then it does really need some automation at the front end to make it work. And then, of course, at the back end, you've got to be able to capture the data. Yeah.
Right. And do we have the capacity to produce the number of tests required to actually make this work for the whole of society?
Well, the answer to that is no, because if you used your imagination, you could use this in any number of different settings. You could use it in schools, care homes, you could use it in hotels, shopping centers, you could use it in businesses, you could use it in any number of different settings. And the truth is, to scale up to that sort of level, I think is definitely beyond our sensible capacity over the short to medium term. But it will be a real benefit where it does get used. And I think I'm hoping that it's not all going to get soaked up by the NHS, because there is a huge demand to try and get some of this testing out in the private sector, where a lot of these activities are going on and where people want their employees tested, their students tested, and so on. So I hope we get to a position where it gets widely distributed rather than just being used in NHS labs.
Right. Two more brief ones, if I may. Do you think that it would help us in stopping the kind of cycle of lockdowns and re-lockdowns?
I think it'll help us manage the lockdowns better. I don't think it'll stop the cycle of lockdowns. I think we are going to get a series of outbreaks, I suspect, which could turn into a second wave or could just turn into a set of events. Managing those events, however, is really challenging, because once you get an outbreak, for example, today in Manchester, previously in Leicester, you want to do very extensive testing, because I just need to remind you that 70% of the people with this virus in their nasopharynx are asymptomatic. And the only way to solve that problem is to test a lot of people to identify all those that are carrying the virus, quarantine them, and stop the spread of the virus.